Hi, I'm Mike Gibson and welcome to SCAI 2018, and I'm talking with Kalon Ho about the new SCAI kit. Talk to us about this Quality Improvement Toolkit.
So Mike, so SCAI kit is the child of the Quality Improvement Committee at SCAI, and it consists of a bunch of tools. There are slide decks for education, there are checklists, and there are also clinical decision support tools. So there are tools for assessing appropriate use criteria for diagnostic cath and coronary revascularization, and there are also some PCI risk assessment tools so you can figure out what the risks of complications are for a patient who you're thinking about doing PCI on.
So how would a doc use this day-to-day, Kalon? What is the kind of thing that has the most bearing on clinical practice? Is it the AUC criteria that they can look it up, or are there tick boxes they can figure out if they're appropriate, and patient in front of them right here, right now is appropriate? How does that work?
Right, so if you go to the SCAI website and click on Documents and Quality, you'll see there's a link to AUC tools. And if you click on that, right now the 2012 version is still up. We're going to roll out the 2016-2017 coronary revascularization one shortly. We're trying to get the bugs out. But if you click there, it'll ask you a series of questions about the patient, and when you get to the terminal note, it will show you, based on the clinical characteristics that you input for the various scenarios for diagnostic cath or for PCI or cabbage, for the things you indicated, whether the ratings for those scenarios are appropriate or inappropriate or uncertain or maybe appropriate. It'll show.
So how does it tell you? Does it give you a range? You know, what will it say back to you? Appropriate, inappropriate, or will you say A, B, C, D? What will it say?
It depends on the scenario. Mm-hmm. So, for example, under coronary revascularization for stable ischemic heart disease, there are 8 questions you have to answer. So I'll show you the answers to the 8 questions, and then I'll say, if you said no cabbage, for example, I'll show you for 1 vessel disease, 2 vessel disease, 3 vessel disease, left main disease, PCI cabbage, based on the anatomical configuration, based on the 8 questions you answered, what the ratings are. So it could be appropriate, maybe appropriate, or rarely appropriate. Mm-hmm. They'll show that to you, and it's color-coded, so appropriates are green, rarely appropriates are red. You can see that on your smartphone or on your computer. If you're using a computer, you can generate a PDF that you can print and put in the chart.
That's nice, so you can document it.
Yep. Mm-hmm. And there's a space on the side for you to comment, and if you want a second opinion, like it's maybe appropriate, you want to explain why you're doing it, you can get a second opinion, there's space to write that down. For those of us who are using electronic health records, there's also a copy-paste option, so you can copy that same information from the app and paste it into your cath report or your EHR, so you get the same information.
To document it, that's great. What about the risk calculator? How does that work?
So there are 2 risk calculators based on version 4 data set. One set's from the NCDR and MASDAC, and the other is from BMC squared. Both of them ask you a series of questions, and then it will show you the predicted risk of various outcomes. So the BMC squared one shows you the risk of death, transfusion, and contrast nephropathy. The NCDR one will show you death, repeat revascularization, readmission, vascular complications, and kidney failure. And that one also comes with a graph, and there's also a grid that shows you the expected 1-year target vessel revascularization rate, depending on whether you use a DS or bare metal based on the stent length and size.
But nothing that says, what if you don't do any PCI in this patient? It just says, if you do a PCI, what happens?
Right. So if you want to think about should you proceed or not, there are other tools not in the SCAI kit that can help you with patient choice and shared decision making, but those aren't part of the SCAI kit.
And for the slides, those would be something you just look on your handheld device, but the slides would also be available on a website that you could use for presentations at your hospital?
So you can download them, you can use them at your hospital, you can take them to do grand rounds in your community, and they're arranged by topic. There are also a set of tips for cardiovascular professionals, for the technologists and nurses that work in your cath lab. There are some tools available. There's also a set of tips of the month, which are very short sort of checklists and guidelines on, for example, how to switch off a DOAC before a procedure, or tips on how to get ultrasound-guided vascular access, a variety of useful things that come out every month or 2 that are very up-to-date and edited by different members of the Quality Improvement Committee.
And anything for patients? I mean, can you show a patient, here's, your arteries, and here's what I'm going to fix? Anything that's patient-centered?
Not in the SCAI kit. There are other external tools out there that are available from different people. One of our former trainees has an app out there that's available for free that shows videos and things like that, but not part of SCAI kit.
Not part of SCAI kit. So where do you download this?
So if you go to SCAI.org, SCAI.org, look under Documents and Quality, there will be a menu on the left that will link you to all the various tools that are there.
Great. Well, thanks, Kalon, for driving this. A lot of work went into this. And thanks for joining us here from SCAI 2018.